And it's time for another Medical Minute. This morning we are at Colorado Springs Orthopaedic Group with Dr. Christopher Jones to talk all about PRP. Good morning, doctor.
Good morning.
Okay, so what is PRP and where is it derived from?
PRP stands for platelet-rich plasma, and it's derived from a patient's blood.
Okay, and so when we talk about patient's blood or PRP, what type of PRP is best?
Generally speaking, there's two different types of PRP. And basically what we're doing is we're taking blood and we're separating out the platelets. The platelets are cells in our blood that not only promote clotting, but they also have growth factors that promote healing. And so the two types of PRP are PRP that actually have white cells in it, and there's PRP that doesn't have white cells, and they have different applications.
Okay, and PRP is used to treat injuries, correct? What kind of injuries are we talking about?
For common injuries or tendon injuries or ligament injuries, and the idea is it actually enhances a patient's ability to heal by increasing the growth factor concentration. So, for example, in the knee, an MCL injury or medial collateral ligament, common injuries like tennis elbow, very commonly treated with PRP. We also treat arthritis, or folks with cartilage damage can be treated with PRP because it really helps diminish inflammation in the joint, which diminishes pain.
Okay, let's talk about a scenario. Where would you recommend PRP versus surgery?
Well, there's a lot of these degenerative tendon injuries that we have, like tennis elbow or rotator cuff degeneration or patella tendon, at our knee. Surgery is not a great answer. So if we can actually heal it ourselves, it's a much better solution. That's where PRP really shines.
Yeah, that's good to know. All right, how is PRP associated with stem cells?
Well, the idea of stem cell, stem cell treatments, which have kind of become a hot button, they're kind of in the same family. And really the idea with any of these treatments is to enhance a patient's ability to heal injuries or just to fight off inflammation. So they're kind of in the same family, but there are no stem cells in PRP.
Okay, what is the treatment process like with the patient who's undergoing PRP?
It's actually pretty simple. They come in and we draw blood, just like you would just with a normal blood draw to get lab work checked. And then we actually spin the blood with a special centrifuge, and that's what separates out the different cells. That process takes anywhere between like 7 and 20 minutes. And then we do an injection, and the injection, literally, most of the injections take less than a minute. That's
actually really impressive and could be a great solution for so many people. With that said, what kind of outcomes have you seen in patients who underwent PRP?
I've actually seen outstanding outcomes. I started using PRP about 12 years ago, so very early on when it was just starting to be utilized over in Europe. And early on I was hesitant to recommend it, but the more that I've used it over the last several years, 10 years, 12 years, I recommend it more and more because I've seen how well people do. But for example, in tennis elbow, most of the literature shows about 90% success rate.
Wow, well that is definitely some great information. And if you've been experiencing pain, maybe it's time to get checked by Dr. Jones and the team at Colorado Springs Orthopaedic Group. ColoradoSportsDoctor.com for more, or CSOG.net. Okay, and all of that information is up on your screen right now if you would like to learn more. And this segment has been sponsored by Colorado Springs Orthopaedic Group.